And now we are chatting with San Juan Basin Public Health. We are not joined by Leanne today, but instead we have a stand-in here. We've got Brian Devine, the Environmental Health Director at San Juan Basin Public Health. What is that? That sounds important.
Well, I got to tell you, we all have two or three jobs during the pandemic. So normally, I supervise our water quality, air quality, and food safety programs. And since COVID has come along, I've been doing a lot of different roles in our COVID response. I do a lot of communications and a lot of media, and help out with our businesses that need to know how to comply. Some of that carries over from food safety. So I'm helping out with our business community, a lot of communications, and just trying to keep everybody safe.
Wow. Yeah, as if, yeah, this year is going to be a hard one for you, obviously, but man, it doesn't sound like the 416 fire was very easy on you either.
You know, I took this job, my first job at San Juan Basin Public Health during the Gold King mine spill. That was my introduction
Oh,
to public health and environmental health. So I've now had the Gold King mine spill, the 416 fire, and now COVID-19. It seems like I get a new job every couple of years.
yeah, my co-host just got into our sales department on March 16th. So kind of, not a great time to start trying to sell radio advertisement when everything's shut down, but it happens to the best of us for sure.
It does. I think this community has shown to be very resilient over the last couple of years. Seems like I said, every 2 years we have something difficult to go through as a community. We have come together in a lot of different ways. It's very encouraging, and certainly at Public Health, we feel like the community is doing a really good job of coming together and getting through this, and we're very thankful for that.
We are never shocked, or I mean, we are always shocked by how giving and amazing Durango is and how they pull together in these times of need. It's unbelievable. You think that there'd be less that they can give, and somehow they pull together and give more. It's really an amazing thing, except for a couple of stragglers out there that are meh, but whatever. The rest of them are good.
Absolutely.
So let's chat a little bit. You were talking about you work with the restaurants and everything about kind of the health and safety of all of that. The 5-star program looks like that might be happening. It looks like it's been approved for 2 different counties in Colorado, and there is the proposal in, and they're waiting on a couple of approvals and a couple of signatures, and hoping to find out today. Do you know anything about that or inside knowledge? Anything?
Really don't have any inside information there. We know that the application has been submitted by the La Plata County Administrative Committee. So we're just waiting for a response like everybody else. This would be a program to allows businesses to operate at a higher capacity than public health orders normally allow after they do an individual plan review with the committee and get an inspection. This is a type of program that we asked for state support on all the way back in the spring because we knew that infection prevention at our businesses and special events was going to be really critical to controlling the spread of the virus. It didn't seem to be a real big priority for the state back in the spring, and I think they've realized as the situation has evolved that that is really critical, and that we need to make sure our businesses and our special events have all the tools that they can in order to keep their customers and employees safe. So we're also looking forward to hearing back this week and seeing how that progresses through the holiday.
Okay, well, and yeah, for people who haven't heard so far, basically, the businesses that submit their applications and go through a long process of everything, like there's so many things that they have to be going above and beyond just the normal precautions to be able to, if we're in red, then they can kind of operate as level orange, or if we're in level orange, they
That's
can
right.
operate as level yellow type of thing, right?
That's right. That's exactly right. That's the whole idea behind it. And it does give there is some acknowledgement for these businesses that have really invested money in making a safer environment. And as you said, they are pretty substantial investments sometimes, depending on the type of business and what they're working with. They should have some acknowledgement of that investment and a little freedom to operate at a higher level. It's really important, of course, that the community responds to a program like this in the right way and continues to invest, in a sense, in good public health practices at the individual level as well. If we are reopening businesses to a higher level, then honor the work that they've put in and keep the community safe by continuing to wear a face covering having these practices in place at a business doesn't mean that you're off the hook for doing your part.
No, not definitely not. And on that note, I think one of the things on that list is contact tracing, where they start kind of taking down the names of the different people that
Yes.
come in, require reservations, that kind of thing. Now, we as individual citizens, rather than businesses, can actually take that a step further. And I know some people are freaked out that Big Brother's watching them and everything, but there is that wonderful little app that we can download that'll let us know if we've come in contact with somebody who's tested positive.
Absolutely. This is another key tool in our toolbox, the Colorado Exposure Notification app. It is completely anonymous. It exchanges data just from your phone to another phone without ever getting your phone number, your name, your address, or the locations that you're at. So this can be really helpful, especially as we reopen things like restaurants and special events. You may not know the names of all of the people that were in that room with you at the same time while you were dining or whatever else is you're doing in that space. And the app isn't going to know their names or their phone numbers, but it's going to know an anonymous identifier for their phone. So if unfortunately you do test positive and that visit to that establishment is within your infectious period, then when we do our case interview and we're talking to you about your case history, we can ask you if you have this app. You say yes. We give you some information to input into the app, and it automatically sends a notification to all the other phones with that app that was in that space for a long enough period of time. So that's a really powerful tool to reach people that you don't know the name and phone number of, and it's really critical that people adopt that. It doesn't take the place, again, of all the other measures that we have to do. We like to think of all these public health protocols as a bunch of layers of Swiss cheese, right? And if you have a single layer of Swiss cheese, it's very easy to pass from one side to the other. If you have a bunch of layers of Swiss cheese stacked on top of each other, those holes are not going to be in the same place, and it's going to be really, really hard. It's a little bit of a weird analogy, I guess, but I think it gets the point across that we do need the exposure notification app. We need you to sign in if you go to a restaurant or a special event. We need you to be wearing a face covering, stay 6 feet apart from other people, and cancel your social gatherings and move things outside. All of those tools are going to be necessary working together as we start rolling out a vaccine, which is another very, very powerful tool, but we don't have enough of it for it to take the place of all of those measures for quite some time.
Well, and for people and businesses both that are interested in knowing what those precautions for the 5-star program are and how to apply and those kinds of things, I believe you can contact the Chamber of Commerce or the Business Improvement District, or for restaurants, the Dave Woodruff, maybe from the Restaurant Association. There's lots of avenues you can go for that. And Jack was talking before, it looks like some relief is coming, which is nice. It's about time. But I did have a couple of follow-up questions on that app. Now,
Sure.
obviously medical conditions are a privacy issue. You are allowed to keep that private and whatnot. So if somebody does test positive, can they choose to not have that information sent over the app? I mean, I hope
The
they
app is
wouldn't,
completely
but
voluntary.
okay.
The app is completely voluntary. No one is required to download this app. This is another tool that helps us contain disease and keep the people around you safe. So
Okay.
no, it's not required in any sense. We do hope people will download it. We think about 20 to 25% of people in Colorado have downloaded it already. People
And
who
where do
have
you find
downloaded
it?
it, of course, you can get it on your Google or Apple App Store. It should be the first thing that pops up if you don't already have it. Or you can go to addyourphone.com, and that will take you to the appropriate download depending on your type of device.
Awesome. And just to clarify, if you do download it, it will not automatically insert a chip inside of you and turn you into a lizard person.
That is correct. That is correct. It's just working on a phone-to-phone basis. It's really a remarkable piece of technology. I'm not a programming or coding person by any means, but the way that they talk about it with the exchange of anonymous information without ever knowing your phone number or your name or the locations that these interactions are happening at, it's really an impressive piece of programming, and we want people to be taking advantage of it.
Absolutely. Well, the last time we chatted with Leanne, we were looking like we were on track to be level orange. Is that still looking like the case?
Yep, still making progress there. We serve both La Plata and Archuleta counties. Archuleta County is seeing a very steep decline in its metrics. Part of that is just because it has a smaller population, so those changes happen a little bit faster. But both of our counties are trending downward in 2 of our 3 key metrics, which is our positivity, which is the ratio of positive tests to total tests. So this is a very good sign because it indicates that as cases drop, it's not just because of lack of testing. There's still plenty of testing available. And then, of course, our number of new cases every day is getting lower and lower. We're on course for level orange, certainly at different rates, and probably will cross into that territory at different times in each county. It's really important that people are going to help that progress continue by being smart over the Christmas holiday and the New Year's holiday. We were really impressed with what the community did over Thanksgiving. Everyone was really worried about a post-Thanksgiving spike. We did see some increased travel and contacts over Thanksgiving, but a really very minor increase in cases that went back down almost immediately. So it does seem like people celebrated Thanksgiving responsibly, whether that was outdoors with a much smaller group or virtually. That's what we need people to do for Christmas and New Year's again. We know how important these holidays are to people, how critical they are to your relationships with your family and friends, but you don't want to get those people sick any more than you want them to get you sick. And it is important that we continue trending downward so we can get our businesses back open in a wide way, and we can get more in-person activities at schools by moving into our level orange protocols. So we are on track for that. It's hard to predict an exact day for it, but all the news is really encouraging so far in both our counties.
Absolutely. And we've been encouraging people because, obviously some people are still going to be going and visiting with their families and
Sure.
everything. We're just asking people to try to keep it to a smaller amount. Maybe don't travel this year. Maybe just keep it with your household or just a small group of family around. And if you can, if you have a space heater, be outside or something, just try to keep it, wear your masks when you can. Just be as safe as possible, sanitize everything. We are so close to getting to be able to have our restaurants open for a little bit more capacity, to be able to dine in again, those kinds of things, to be able to help people to have jobs so that they can buy Christmas presents for their children. I mean, it's a time that it's the most important time of the year to not be selfish, and it's even more so this year. So just everyone, please do as much as you can to try to make that a little bit better.
Very well said. It is the season of giving, and this year we need people to give each other a safe holiday experience.
Absolutely. Oh, I lost my train of thought there. Well, let's move on to the vaccine. What's new with that?
What's new is the vaccine keeps arriving in Southwest Colorado, and we continue to distribute it with our partners. I'm sure your listeners know that we are working on a phased distribution plan because there is not enough vaccine to go around yet. It's being produced by the manufacturers all the time and then being sent out to the states and then out to the regions from there. We got a new shipment in just yesterday, some to our local hospitals as well as to public health. So we are working our way through the remainder of what we call Phase 1A, which is our high-risk healthcare workers, and we are getting started on some of our long-term care facilities, our nursing homes. Unfortunately, we know here in Durango how risky those environments can be for the spread of disease. So it should be the case that after this shipment is completed, we'll have the first doses done for our high-risk healthcare workers, and we will have made really good progress on our nursing homes. As a reminder, the vaccines that we're dealing with here are 2-dose vaccines, so this is just the first dose for all of those folks. But if we can continue to receive weekly distributions from the feds and from the state, then we'll be complete with that first priority phase in the next couple of weeks with second doses, and be moving into our Phase 1B, which is going to include some of our first responders, our lower risk healthcare workers, as well as some high risk individuals in the community. So we'll be working our way through Phase 1 pretty much for most of the winter. It really depends on the manufacturing schedule from Pfizer and Moderna, and then if other vaccines get approved, we'll be working our way through that. And then around the spring, we'll be starting distribution for the general public, starting with our higher risk categories, hopefully in the early spring. It's really exciting to be a part of this. It's a really incredible achievement that there are 2 safe and highly effective vaccines available for this disease, essentially a year after it came into existence. That's unprecedented in the history of public health and healthcare. And it's really humbling to be a part of that, and to see the reactions when people who've been out there in our hospitals saving lives every day for the last 10 months are able to give themselves a measure of peace of mind by getting vaccinated. We're so grateful to be a part of this, and just to see that things really are going to get better. The entirety of this pandemic since March, we've been talking to people about flattening the curve. That's in everybody's vocabulary now, right? Flattening the curve. And really all that was delaying the possibility of infection. Now with vaccination, we're actually removing the possibility of being infected from large portions of our population over time. That's a huge change for us. And it just means that when we start to do vaccination for the public, it will just get better because fewer and fewer people will be susceptible to the virus in the first place. It's really a sea change in how our community approaches this pandemic and how we think about what's going to happen in the future.
Absolutely. Do we know, as and I know this is kind of an open-ended question here, I guess, but as it's Moderna as the second one, right?
That's right.
Okay. So as it comes out and as we start to get more and more vaccines sent to us kind of at a certain pace, and as this dip happens and after Christmas, I mean, is there any kind of idea of when we might get more of a concrete timeline of when the vaccines will be able to be distributed, or when we will be able to actually officially go to level orange or anything
Sure.
like that?
I think those are pretty separate. We're not relying on the vaccine to
Right.
get us into level orange by any means. That will really just depend on what people do for Christmas and for New Year's. As far as a regular schedule of vaccine distribution, we really don't have that at the moment. Right now, we're doing this 1 week at a time, one shipment at a time, one box at a time. That's about as much advance notice as we get, is that there's going to be another shipment, about what date it is and about how many doses it will be. We're hopeful that the state and the feds will be able to provide a little bit of a long-term schedule, and I think that will really depend on stuff way out of our control, manufacturing schedules, contracts at the national level. But our plan is to have regular vaccination clinics for the public this spring and summer. Those higher risk folks in the spring, and then for the general public in the summer. That's about as detailed as we can do right now, but we're doing a lot of planning to make sure that goes as smoothly as possible once we have enough vaccine available to do so.
All right. Well, and to me, I don't know how it sounds to everybody else, but to me, the idea of getting to 1B in a matter of a couple of weeks is phenomenal to me. It sounds like we're moving right along. So,
Yeah, we're the only region so far with 100% on-time redistribution and administration of vaccines so far. We've really figured out how to get this vaccine to our healthcare facilities and to our vaccine clinics. As I said, we're 100% on time, successful so far. So our goal is to keep that at 100% and to continue to get vaccine into the arms of people who want it and who are eligible for it on time, so that they can be safe as quickly as possible.
all right. Well, Brian, I do want to tell everybody one more time, please, 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 for the sake of everyone, let's not make 2021 the same as this year. Let's start to improve it. Please just be safe for the holiday season. We're right around the corner, but it's right around the corner that we could be doing much, much better. So please be safe out there. And Brian, is there anything else you'd like to add?
No, I just want to echo that message. Again, this community continues to impress us with how we come together, support each other. It feels a little bit different this time, supporting each other remotely, but that is what we need to ask of our community for a couple more times. Be safe this Christmas holiday. Be safe on New Year's. I'll be celebrating the end of 2020 just like everybody else will. I'll be doing it by myself, and I hope the rest of us make good choices there, again, so we can move into level orange as quickly as possible, get more businesses open at higher capacity, and see more in-person learning options for our schools. That's really, really critical for all of us. I know we all share that goal. So we're going to do our part, and we just ask the community to do their part.
Yeah. And I know I'll be celebrating with just two of my closest friends for New Year's, bottle of champagne number 1 and bottle of champagne number 2. So,
Absolutely.
uh,
A good plan.
thank you. All right. Well, Brian, thank you so much for joining us today, and good luck out there and happy holidays.
Same to you. Thanks so much for your time. Thanks for having me on.
Absolutely.